Your passcode has been confirmed. If you need technical assistance during your call, press *0.
After the tone, please state your name, followed by the pound sign.
I'm sorry, we did not get your name.
After the tone, please state your name, followed by the pound sign.
I'm sorry, we did not get your name.
After the tone, please state your name, followed by the pound sign. This conference is in silent mode. There are 37
parties in conference, including you.
She spearheaded the successful Joint Commission Disease-Specific Certification of Distinction for sickle cell disease at Memorial Regional Hospital, the first in the nation. She currently serves as Chief Medical Officer for the Sickle Cell Disease Association of America and on the National Heart, Lung, and Blood Advisory Council, National Institutes of Health. Dr. Jordan was appointed to the state of Florida's Healthcare Transition Task Force for Youth and Young Adults with Disabilities in 2009 and remains on its Medical Advisory Committee. Dr. Jordan completed a Doctor of Medicine dual degree, receiving her MD degree from the University of North Carolina at Chapel Hill School of Medicine and Master of Public Health degree in Health Policy and Administration. Her clinical training is in adult psychiatry. At this time, I would like to ask Dr. Jordan to please unmute her phone by pressing *6 in order to begin addressing the audience. Dr. Jordan?
Okay, all righty.
Yep, we can hear you. Thank you.
All righty. Hi, everyone. Thank you, Mary. Thank you so much for the introduction and the opportunity to give a presentation on sickle cell trait and what every community-based organization needs to know. This is obviously a topic that has been around for some time, has died down after the initial coming out party, so to speak, in the 70s, and now back in the spotlight, and with many agencies and organizations weighing in about the public health implications of sickle cell trait. So we, at the national organization, have developed a policy. We've emailed that policy to the member organizations because we know that our member organizations are receiving a lot of questions about the type of information to provide and the type of services to also provide for those who are seeking information related to sickle cell trait. There are 4 sections to talk today. One is who should be screened. 2, genetic information is confidential. 3, what are the risks and benefits of sickle cell trait. And 4, screening programs should offer individual counseling. So the first section is who should be screened for sickle cell trait. And is screening for sickle cell trait mandatory at birth? Well, screening is a public health service, and we do now have universal screening for all of the states in the United States, but technically it is not mandatory. I mean, a mother can refuse to have her newborn screened, but this is highly unlikely, and I don't know of any situations where this has actually occurred. But all to say that screening should be voluntary outside of the newborn screening period. So within the newborn screening period, it is a federal mandate that newborns are screened, and outside of that, it should be voluntary. And all newborns are screened, so we do have universal screening. Why is this important from a population-based perspective and what the public health implications are? These are not small numbers. although sickle cell disease is considered a rare disease because our current estimations are less than 200,000 a year, 200,000 people in the United States with sickle cell disease. Those with sickle cell trait certainly are quite large. So we have 4 million estimated in the United States and 300 million around the world. And we have an estimation primarily because we do not yet have a surveillance system that is able to capture this information. So, you know, it comes up many times that when we think about who should be screened, we should also think about who should be rescreened. And certainly those who have been screened, and when we look at the population of, say, athletes who are, you know, active, you know, today, they likely have been screened in the newborn screening program. However, that information related to newborn screening is not maintained in a way that individuals can access this information on a need-to-know basis. So we're faced with, in particular, some issues related to trait now. We're faced with rescreening individuals who have been previously screened. Again, from a public health, population-based perspective and an economic perspective, we should not be in a situation where we have to rescreen. If that information has been collected, we should have the infrastructure in place so that we would be able to inform. But, you know, this is likely something that will come down the road. But right now we are faced with many individuals who are being rescreened for various reasons. Now, outside of the newborn screening period, who should be screened? You know, given the large number of individuals who are estimated to have sickle cell trait, the public health infrastructure is likely not equipped to handle all of the counseling, the individual counseling that would need to go along with population-based screening. So in those situations, we may start to look at targeted screening and not so much targeted screening, targeted counseling. And so, for example, if there is a couple, an expectant couple planning to have children, they should be offered the option to test for gene mutations that cause sickle cell disease. Ideally, this should be done at the time that the marriage license is obtained, because that would then take away any issues related to individuals not selecting that individual to marry because of a potential genetic risk. But we don't universally or uniformly have a process in place where we actually offer screening to expectant couples. Also, anyone with a family history of sickle cell disease should be aware of their trait status, and they should consider screening, should be offered the option to be screened. People with a history of thalassemia and also people with a family history of sickle cell trait. Next slide. So again, just to sort of re-emphasize, who should know that they are a carrier, that they have sickle cell trait? Well, it really should be everyone. And we do know that there are pockets of individuals that may have some risk that may not necessarily pertain to individuals who are not involved, for example, in strenuous athletics or who are not recruits. But we do highly support that everyone should know their carrier status. So how does all of this relate to genetic information, and how does the protection of that genetic information relate to where we are in today's healthcare environment and protecting our personal genetic information? Genetic information is confidential, and I think that with some of the climate topics today, in today's environment, we're faced with, well, how confidential is this information, and if someone wants to share their genetic information, should they share their genetic information? Well, you know, certainly if you as an individual want to share your medical history on any level and with whomever, that is your prerogative to do so. But you should not feel forced to do so or somehow coerced to do so in hopes of achieving an end result or hope to achieve an end result that really causes you not to fully think through sharing or not sharing your genetic information. So because of the sensitivity of genetic information, there has been placed into law the Genetic Information Non-Discrimination Act, best known as GINA, G-I-N-A. This was actually passed in 2008 and implemented in 2009. And there are two components to this law. There's Title I and Title II. Title I is that it's illegal for health insurance providers to use or require genetic information to make decisions about a person's insurance eligibility or coverage. And I've had conversations with the SCGAA member organizations, and we know that there has been issues related to individuals with sickle cell trait who have been denied coverage. The next slide highlights Title II of the GINA, which again was implemented in 2009, where there is prohibition of genetic information discrimination in employment. So again, it's illegal to discriminate against employees or applicants because of genetic information. But as you review this law, it covers certain entities. So if you are not a federal agency or a large employer-based agency, you may not be covered. So you would have sort of an opportunity to create a barrier for someone with a genetic disorder or with a predisposition. You could not include them in your employer program. So although the laws are there to protect, there are gaps in the law. And we think it's important for member organizations to be aware that there are gaps and to navigate what is happening in your state to best understand what some of the challenges are and to provide information so that you will be able to, during your counseling, inform individuals of all of their options and the best road to take. So again, just to highlight, we don't want to alarm individuals when we're providing counseling, but we do want to cautiously explain that insurers have denied people health insurance for having sickle cell trait. So do understand your state's pre-existing condition laws, but as of noon today, we may all not have to worry about some of these issues related to pre-existing conditions unless the Affordable Care Act is reversed. But right now we may start to look at pre-existing conditions and even with sickle cell disease, those who do not have insurance, how those individuals will now be insured. So we will continue to monitor the outcome and how things change with the Affordable Care Act and form our member organizations so that they can provide the best information to their client population. And, okay, that's okay. So we can move on to the next one. So Section 3, what are the risks and benefits of sickle cell trait? And so some of you may be thinking, well, risk, yes, but benefits, I'm not quite sure of. Well, there are some benefits to sickle cell trait, even today. Sickle cell trait does provide a survival advantage over people with normal hemoglobin in regions where malaria is endemic. So this, to the left, is Anopheles mosquito, which transmits the parasite that causes malaria. Wreaks havoc on in endemic areas on individuals who do not have this survival advantage. Although there is now medication to treat those who are infected, there are still severe health consequences even today in some of those regions. And then below I just have a red blood cell electron micrograph here that shows, that shows the infection of the malaria parasite and how it really destroys the red blood cell. If some of those cells were crescent-shaped or sickle cells, particularly in areas in the body where there's deoxygenation and the cell is more likely to polymerize and form the sickle shape, then it creates a barrier for the parasite to have entrance into that particular cell. So that's why it has become a survival advantage, because of that single gene mutation. Okay, next slide. So that is certainly a benefit we never, I think, really discuss with our families, that there is a benefit to having sickle cell trait. And, maybe if we start to sort of refocus some of that conversation, we may not see some of the psychosocial and psychological not so much disturbances, but just conflicts when babies are born with sickle cell disease and the parents, feel guilty in some of those issues. So I think there's some opportunity there. But there are some risks of having sickle cell trait. Increased risk of clot formation in women who use hormonal contraception. Here, the member organizations can craft their conversations to counsel these women with sickle cell trait about the need to understand the different types of oral contraception pills and other contraception methods to prevent pregnancy if that's their goal, not prevent pregnancy because of sickle cell disease, but, just in general. And also encourage women with sickle cell trait to visit a gynecologist who is knowledgeable about sickle cell trait and hormonal contraception. Next slide. There are risks of bacteriuria or pyelonephritis, which is an inflammation of the kidneys associated with pregnancy. So it, although many have said, and certainly in the literature you've seen, that sickle cell trait is a benign condition. There are some risk factors, and we do need to be aware of those and provide counseling appropriately. Next slide. There are kidney and urinary tract problems. So, for example, some individuals may not be able to concentrate their urine, so their urine is very dilute. There may be blood in the urine or hematuria, secondary to renal necrosis, papillary necrosis, and although very rare, and when we think about these 3 million people in the United States, we certainly don't want to alarm them and sort of, run out the door, screaming that you're going to have, these types of issues. These are rare, but these are risks that can occur. So we certainly just want to make sure we provide individuals with all the information that we're privy to based on evidence, and as we are updated, that we'll update our population. But the renal medullary carcinoma, which is primarily seen between the ages of 11 to 39 years, is a very rapid cancer, and individuals succumb to this cancer. But again, it is very rare, but more cases are being reported. So if anyone with sickle cell trait presents to your community-based organization and reports having blood in their urine or any of these issues, repeated urinary tract infections, ensure that you do encourage them to see their primary care physician so that they can be referred appropriately. Okay, next slide. And we, certainly are quite aware of the risks that have been related to football in particular, but sports in general. There are risks outside of sports, such as high altitude for individuals with sickle cell trait, where there can be splenic infarction. But this was very highlighted with Ryan Clark and his playing against the Denver Broncos, and the issues he had with having his spleen removed and also the need to have his gallbladder removed. Next slide. There are other risks. The collection of blood in the eye, called a hyphema, and with repeated or if this is not corrected or treated, can lead to glaucoma. So again, not to alarm individuals, but certainly to be aware and make them aware that if they start to see any symptoms, then certainly they need to be referred to their primary care provider for further assessment. And what do we do about the risk associated with heat-related illness? We know that heat-related illness is not an exclusion. It is not limited to individuals with sickle cell trait. Anyone can suffer from heat-related illness. Is there a higher risk related to sickle cell trait? There certainly does appear to be, but what we don't have is the research to fully understand are there other risk factors in addition to sickle cell trait, or maybe it's just coincidental that someone has sickle cell trait and that there is a higher risk. We just don't know. But needless to say, we do want to make sure that our member organizations do provide the necessary counseling to individuals who are playing sports in general that come to you, but those with sickle cell trait, to make sure that they understand that they do need rest cycles, that they need to build up and become acclimated to heat and training programs. They need to be well hydrated, and it is very important to understand when they are in trouble in terms of heat-related illness. So we have very specific information related to the identification and rapid detection, and so we'll have information available for our member organizations for their counseling. So what should screening programs do? And with any genetic, when we're assessing genetic risk and counseling individuals, we feel that there certainly should be counseling on an individual level. One, inform individuals of their rights to protection of genetic information. Inform them of their risk, if they have risk, about family planning, possible health outcomes, and participation in sports, for example. Refer them to the appropriate health care provider or providers. Educate individuals on how sickle cell disorders are acquired. Sickle cell trait does not turn into sickle cell disease, and member organizations have, reported that many individuals still believe this, that sickle cell trait is contagious. There are a lot of misconceptions that are still in our communities that we certainly need to work to educate individuals about how you actually acquire sickle cell disease, and inform individuals on the difference between sickle cell disease and sickle cell trait. Educate them on the appropriate test for sickle cell hemoglobins. And, a sickle dex is not the test that will highlight those various hemoglobins. We need the hemoglobin electrophoresis, for example. And educate individuals on the types of hemoglobins that can result in sickle cell disease. So it's not only the test, but also the type, and individuals, when they are with their health care providers, should have the necessary information and the knowledge to have a conversation with their provider to ensure that they're understanding that, do I have hemoglobin S, hemoglobin C, do I have thalassemia trait? What is it that I have, so that I'm not shocked if I then have a child with sickle cell disease when I'm under the assumption that I do not have to worry about having a child with sickle cell disease. And this relates to family planning and what those family planning options are. For example, in vitro fertilization may be an option for couples, but if they don't know that this option exists, they may make decisions based on limited information. So it's certainly not for us to be in a position where we withhold information, but we should afford all of the clients all information that is available and options so that they can make the best informed decision for their families. And educate individuals who are participating in sports, regardless of what level they're at. Could be Pop Warner football. They all need to recognize the symptoms of heat-related problems with or without sickle cell trait. So, for example, there could be, family members. One could have sickle cell trait and the other one could not. We don't want to inform one family member without the other. They should all be aware of heat-related issues just in general. So this speaks more to the universal education. Some is specific to sickle cell trait and some is not specific to sickle cell trait. And I thank you. Okay, and thank you. And if there are any questions.
Great. Thank you so much, Dr. Jordan. We will now go ahead and open the line for questions. So you have one of two options. You can either raise your hand electronically in the Q&A window, or if you don't have access to that and you just want to go ahead and ask Dr. Jordan a question, I'm going to ask you to push *6 on your phone so that we can hear you. So do we have any questions on the line?
Hello.
Yes, we can hear you.
Hi, Dr. Jordan. How are you doing?
Hello. Is this Karen?
Yes. You know I'm excited about this presentation, right?
That's good. That's good.
Now, I just want to know, because all the information that we have right now when it comes to sickle cell disease and sickle cell trait, we might have one paragraph about sickle cell trait. You gave us a lot more information, a lot more current information. Do you know when any of this information is now going to be put in a booklet format or something?
That's an excellent question, Karen. And Karen is with the Sickle Cell Disease Association of America, Broward County chapter. The CDC, in conjunction with the American Society of Hematology, they're actually working on a toolkit, a sickle cell trait toolkit. And SCDA is certainly involved in that process. I am actually involved from the family planning component and education, and Dr. Kim Smith-Whitley on sickle cell trait, and I think without complications, and then Alexis Thompson's, with athletes, Dr. Alexis Thompson's is sickle cell trait and complications in athletes. So we are just now working on that toolkit. The teams are together, and as soon as we have a product ready to roll out, we will get that information out to the member organizations because we realize how important that is.
Okay, thank you very much. That was my only question.
Okay.
Wonderful. Do we have any other questions on the phone? If so,
yes.
just remember, press *6 so that we can hear you.
Do you hear me? This is Anthony Cox with the Broward County Sickle Cell Association.
Yes, I can hear you.
I was wondering, have you spoken with any athletes that have sickle cell trait or sickle cell disease to find out what it is that they experience before they have a problem due to heat exertion and things like that, overheating?
Not related to their any health issues. And we don't have, although we are working with the NCAA, we don't have any data from the NCAA to really understand, are there any, pre-symptoms or, but down the road as we continue to develop the research agenda related to trait and look at epidemiological studies, we should, start to be able to gather some of that information. The conversation with the athletes now pretty much center around we just need to get, this result so that we can hand it over to our, colleges and universities so that we can play. So that is that's the conversation and the comments that I've heard. But we are looking at ways to better collect the data. And it could be that the member organizations, will be a very strong partner in that, because if you're, on the field, so to speak, and you're interacting with these athletes, you can certainly, if we sort of provide a tool for you to collect data, you can also, help us in a situation where we can collect the necessary data to understand are they having some symptoms, even days before, and what conditions are they having these symptoms? Is it during, when they first start with training, and, are they more active on the field than they would be? Is it hot outside? So we just don't know what all of those special conditions are yet.
Right. Well, I can tell you firsthand from when I played baseball in college. Like the first couple of weeks of training was hard for me because I was born with sickle cell disease, and I would have to take more water breaks than everybody else on the team because I could feel when my body was starting to, go into different effects from having sickle cell disease, and I would have to stop and drink water, and once I felt myself getting back to normal, I would join the routines of the baseball team. And so that's why I asked that question, because we have to find out, how it affects them before, they go into that trouble stage. Because a lot of kids that are playing football and baseball, it might be their first time playing organized sports, and the coach will push them and push them and push them, and they don't know their breaking point because they've never played organized sports before. That's what I'm seeing down this way in Miami and Broward County. A lot of the kids are having trouble in that aspect.
And, I would say that if you have sickle cell disease versus sickle cell trait, you certainly need to be in close contact and have a very good relationship with your doctor because, I view that as if you are playing sports and you have asthma or, any other disease, diabetes, you're going to be managed a different way than someone with sickle cell trait, just in general. So if you are participating in sports and you have a chronic condition, you certainly do need to be very, hands-on about your disease and those trigger signs, and really work very closely with your healthcare provider. So I do see that as being different in that way, because we know that you would have you're going to have more issues than someone with sickle cell trait or someone with normal hemoglobin.
All right.
Wonderful. Do we have any additional questions on the phone? If so, any additional questions, just press *6 so that we can hear you.
Yeah, I have a question regarding some of the other complications that you go through in your list of risks for people with sickle cell trait. Most of them are things that are not, from what I can sense, really clinically significant, like the decreased urinary concentrating ability. Perhaps that just means, again, care with hydration and things like that, hematuria. There's not anything that really is done differently for those patients, if I'm not mistaken, or bacteria. The only things that really would require kind of pre-screening for problems might be, I guess, renal medullary carcinoma, but that, it's very rare. So I'm trying to see if there's anything really that we would add to a screening besides education of these patients, that we would add to any types of specific screening care for patients that we are following.
Right, and I think it is, just as you stated, it is more related to screening care. So screening in and of itself, if there's no real intervention, then the experts say you really shouldn't screen.
Right.
So I think it's just more of a recognition that there is a risk, and they should, be monitored, at least have an appointment or work with a healthcare provider who can provide an initial evaluation and just maybe, a few follow-ups just to make sure there's no development of anything adversely that can occur. But no, I fully agree with you, which is why I wanted to emphasize that, these are rare, but certainly these are things that have been associated with sickle cell trait.
Okay, thank you.
Great. So, Dr. Jordan, we have a question from the computer. It's from Eileen Murray.
Okay.
She says, we know some information has gone out to NCAA, but what about high schools, grade schools, et cetera? How are the smaller sites for students or others who are playing a sport will also get this information?
Yes, and that's a great question. And the toolkit, we are actually looking at who are the target audiences, and we will, I think, look to advance this outside of the NCAA. And then I, certainly did not create this talk to address the NCAA's ruling specifically. I think this is we're back fully into the public health realm of sickle cell trait and what information do we need to disseminate to the general population.
Hi, Lanetta. This is Althea. Also, I wanted to chime in. And, yes, you're correct. I'm actually facilitating the athletic work group.
Okay.
Don and I. And we are very much broadly targeting. It isn't the information for athletes isn't specific to NCAA and not even specific to college. We're trying to develop materials and messages for coaches at every level of athletics and for parents and athletes at every level. So definitely we're trying to develop materials for all of those audiences.
Yes, great. Thank you.
Wonderful. We have time for a few more questions if there are any on the phone. Just press *6.
Hi, this is Karen again. I didn't disclose this earlier, but I feel a need to. I have sickle cell trait. And I think within the past 3-4 years, I've experienced a lot of leg problems. And I noticed that after, let's say we have a big event, my legs hurt me so much to whatever shoes I have on. I have to take off and barely walk out of my event bare feet. So I think it comes from me being tired or exerting myself. And I just wish that more studies can be done on everyday people that have sickle cell trait. About 5-6 years ago, and this is personal, but I don't mind sharing it because I think it can help. I was on birth control pills, and I kept having leg cramps. And it wasn't until I had a conversation with my gynecologist, and I said, I realized that one of the side effects of birth control is blood clogs. And she was like, yes, well, you have sickle cell trait, so you really shouldn't be on birth control. And I'm like, but you're about to give me a script for me to get on birth control pills. So I think that there's so much information that the public needs to be aware of, not to put an alarm, but just let people know. Myself personally, if I do not rest and I overexert myself, I cannot walk because my body just cramps so bad. And I'm like telling my doctor, listen, use me as a guinea pig so we can get a better understanding of what's going on with sickle cell trait. And I think that's what my problem comes from is the sickle cell trait. And it's as I get older, I start having more problems.
Oh, well, I appreciate that comment, Karen. I wish I could say as I get older I didn't have problems, but as I get older I do have more problems for whatever reason. Certainly with birth control pills, there is a risk of blood clots or thrombosis in all women, and there is an increased risk with women who have sickle cell trait. So, and it's not so much that you can't be on birth control pills, it's the kind of hormone that's in the birth control pill that's important. So again, your gynecologist would be able to provide that information to you, but this is the type of language that we want to make sure that we have available to our member organizations, as they counsel clients that, if you do have sickle cell trait and you're, now in the age where, you are thinking about preventing pregnancy or whatever the case may be, and you're thinking about birth control pills, please go see your gynecologist because that you can't take all types of birth control pills. And I think that's sort of the language or the message that we want to get out.
Dr. Jordan, is there any thing being done about bringing screening back into the communities? I mean, or right now it's like when you start talking about sickle cell trait and you tell people that, we all need to know our status, the question comes, where can I go at to get a screening done? And right now, I don't know what to tell them, to be honest, and it's kind of embarrassing. I mean, I can tell them to go to their primary doctor, but when people don't have insurance, that's a problem. And I know the new law has came out with, but what do you tell people? What are we supposed to tell them?
Well, what you did, I mean, they really do need to go seek out their primary care provider and be guided. And not to say that all primary care providers are going to be up to date with sickle cell disease or even sickle cell trait, and there are some initiatives to address sickle cell disease. But we do need to encourage them. One, we need to equip them with the information and encourage them to work with their healthcare provider. Hopefully, we can also, as member organizations, develop relationships with some of those providers so that there can be, a flow of information both from the community perspective and then also from the healthcare provider perspective. But from a public health perspective, this is something that the CDC is really working on because that is their realm, public health surveillance and prevention. So I don't know if Dr. Grant would like to add anything to that in terms of just, overall screening outside of the newborn screening period if people want to be screened and don't have insurance. And because I know the public health departments, at least here in Florida, they've stopped screening adults.
Correct.
Right.
Yes.
So, Lanetta, this is Althea. I can't speak to that specifically, like access to screening. I know, obviously, one of our Healthy People of 2020 objectives is to promote people knowing their status. And we do have a new grant out to build capacity to do screening beyond newborn screening, to build capacity of labs, other labs to be able to screen all kinds of hemoglobinopathies across the lifespan. But I think from our perspective, we're hoping that, the healthcare mandate and the expansion of healthcare coverage will make people actually have access to physicians, because knowing your result without having someone to consult would also not be helpful. So I think it's a big picture issue.
Right. I agree. Yes.
Okay. So we have some more questions on the computer. I'm going to go ahead and move to those. The first one is from Marcia Wright of the SCDAA Eastern North Carolina chapter, and she asks, do you think there is a need to gather data from people with sickle cell trait on their individual issues, perhaps as a pilot effort?
Under individual issues such as,
I think
like
maybe
I'm not sure if I'm...
applications or their, Marcia, you could jump in.
If Marcia's on the phone and you want to press *6.
Can you hear me?
Yes, we can.
Yes,
Hi, Marcia.
I couldn't get the phone to act right, but I was listening to Karen, and we've had, through the years, other people to report issues, and, you have a standard of care, at least in our state and all over the place, where unless you have a disease condition, there is no payer or support for following your quote-unquote illnesses relative to the carrier status, because we've always said it's benign. And so when you hear reports like Karen, we've heard those kinds of things all through the years, but didn't really know how to respond to them. And recently we got a note from someone whose wife and daughter, newborn, have both been identified with sickle cell trait. He's very interested in doing whatever he can as an individual and them as a family, both he and his wife. And I'm just wondering if as a sort of a research or not technically research, but you know what I mean, just gathering info from people. When we do genetic counseling, because we get the newborn screening results, and we do get lots of people with sickle cell trait as a result of newborn screening. And we're doing the genetic counseling part, but we don't often get into, even with our adults, are you having, I wouldn't say symptoms related to your sickle cell trait, just the general question, that you can get asked these kinds of things from people and say, well, you have sickle cell trait. Have you ever experienced anything you might think has been related to this and people just told you no, it wasn't, or you weren't sure? It wouldn't be research purely, but it would be gathering anecdotal information to see if there are a few people, a lot of people, a whole lot of people, anecdotally what the situation might be, which would then lead to some further, on a pilot level, which might lead to further research.
Right. Yes, I understand now. Yes. So I'm not aware of any long-term studies related to following individuals with trait and monitoring all of their symptoms. Maybe that is something down the road that, we may want to look at. But, again, when we think about, 4 million people in the United States who have sickle cell trait, if there were such widespread problems, that really resulted in medical intervention or the need for medical intervention, I think we would know that. So, there may, with anyone, particularly with, genetics involved, there could be some phenotypic variations in the way signs and symptoms are presented. So, and what I mean by that is, one person may have trait and 10 other people may have trait, but they all really have different symptoms. And so we don't know what all of those symptoms are related to. There could be some other gene modifiers that are there. And so we, again, I think cautiously will approach how to collect data related to sickle cell trait. But I think what is important is that the Sickle Cell Treatment Act that was passed by Congress and allowed for federal matching funds for enhanced services for sickle cell disease, but also for counseling and awareness. We can advocate, and SCDA is working with an organization to develop a policy brief for advocacy based around these services, enhanced services, and also the outreach and awareness. We may start to best understand some of the issues related to sickle cell trait and actually look at, maybe some ways to start monitoring data. And we may be able to monitor some of that data by what we capture on the healthcare provider side of it.
Yes, thanks.
A process of actually counseling and recording data, have a way to hopefully capture and mine that data and start to see some correlations.
Thanks.
Wonderful. Thank you. So it looks like we have 2 more questions. We're going to try and get through those before the end of the session. The next one is from Coretta Dunnerette, maybe, and it says, Dr. Jordan, can you repeat the recommendations you stated regarding screening for couples applying for a marriage license?
No, that was just an example that if, in the best case scenario, when couples go to, if they decide they're going to get married, they go get a marriage license, that would be the time to approach them about screening for genetic disorders or being at risk. Because it's not, you're then not saying, well, they've already decided to get married, so they're likely not going to change their minds. So you're not sort of instituting a process where you're saying, well, screen first and then ask someone if they're a carrier, and then you just avoid them altogether. So it just and it gives you an opportunity for the couple to understand their options, understand obviously their risk factors. They may have none, but if they do, it gives you an opportunity to start to counsel them about what some of their options are. But we don't, it's not, I think it's more of an ideal situation. It was actually stated by Dr. Francis Collins of the NIH when he discussed screening for cystic fibrosis, and that the optimal time would be, couples, when they're going to get the marriage license, to approach them then. But realizing that you would then leave out, obviously, a population. You would not have those who weren't going to get a marriage license. So what about, people who choose to have children without being married? So, there's so many levels of what can be done that from a population perspective, we try to be as inclusive as possible. And, so.
It's a webinar.
All right, wonderful. So just remind everyone who's on the phone and has asked a question, if you're finished asking your question, to push *6 again so that you're muted again. And then we have one final question from Tommy Thomas Sr. Should athletes with trait be seen and cleared by a hematologist prior to participating in sports in school and in college sports?
Well, it's hard to say that they need to be seen by a hematologist. They need to be seen by someone who has expertise in understanding hemoglobinopathies. And if that's a hematologist, great. Certainly there are hematologists who fully understand, and then there are hematologists, who do not understand in the level of detail that those hematologists who are experts would like for them to understand. So the key is that they are evaluated by a healthcare provider who clearly understands the implications related to sickle cell trait and any kind of sport that the individual is going to participate in.
Wonderful. Thank you so much. So unfortunately, our time is up for this session. Obviously, this is a very interesting topic to a lot of people. And Dr. Jordan, we thank you so much for giving such a wonderful presentation and providing so many great answers to the many questions.
Thank you.
So I wanted to let everyone know that our next webinar is going to take place on Thursday, July 26th. The title is Improved Survival of Children and Adolescents with Sickle Cell Disease, given by Dr. Charles Quinn of Cincinnati Children's Hospital Medical Center. And if you have any questions about today's presentation or the future ones, please feel free to contact Shay Pope at spope@cdc.gov. And as a reminder, all of the recorded webinars are available at scinfo.org under the webinars toolbar. I believe all of our prior webinars are now posted, and I'm sure that Dr. Jordan's will be up there within the next month. So thank you again for participating. Bye-bye.
Thank you. Bye-bye.